Thank you to everyone who's still out there, who has made it through the full day. And I think probably like me, many of you have been looking forward to this particular session, actually. One of the themes certainly that has come up during this year, but that we've tried to emphasize today during the meeting is that we've all learned quite a bit this past year. We just were having a conversation I can't imagine us ever having a year and a half ago about leaving notes on our doors for our kids to leave us alone because we're in a conference. But life has changed, and I think that is a major component of what we're about to hear from Doctors Rene, Jamison, Skylar, Bellinger, and Leni, Swails. Each of them really led a workshop webinar last year, April 10th, over a year ago now, that I thought was just fantastic. And hopefully you all found it quite helpful as well, as we were just starting to enter the pandemic. And so I'm eager to hear about a year later what lessons we have learned, and I'm eager to hear about their experiences for the next, I guess, 45 minutes to close us out. So thank you all for doing it, and go ahead and take it away.
I'm a psychologist at UMed, and I'm presenting with my psychologist colleagues, Drs. Bellinger and Jamison. And we're each going to be taking a turn talking about some kind of distinct areas. So I'll be talking about autism, mental health, and COVID. Dr. Bellinger will be talking about treatment and assessment. And Dr. Jamison will be talking about social networks and resiliency. There's a couple of themes that we were thinking about as we were planning for today. And I think the first theme is this year has kind of been chaos. I don't know if other people feel that way too, but let's be real, this year has been kind of full of COVID chaos. So we're going to talk about some of the chaos that I think we've all experienced as we're thinking about COVID and autism and mental health. The other thing too is we're talking a lot about trying to find the silver linings and what aspects of this year we want to take with us as we move forward. So there's this idea in mental health, and I'm a psychology nerd, so I'm always interested in like, what does the research tell us and show us? But there's this concept of post-traumatic growth or benefit finding. And it's this amazing thing that we can do as humans where we go through something really crummy, like a loss or an illness or all sorts of really hard life stressors. And we have this amazing ability as humans to say, that was bad, I really wish it didn't happen, but I've learned something from it. And there's something about me that's changed, and there's something that I like that's changed in my life as a result of that. And that's this idea of benefit finding or post-traumatic growth. And so that's sort of a theme that we'll be talking about today is, yeah, this year was really crummy. That's true. We wish it hadn't happened. But there are things about it that we were able to find the silver lining. We're able to find some of those benefits. And there's also things about it that we want to take forward with us as we move into this, new world that we have. So you'll see these icons throughout as we're trying to highlight the chaos, the silver linings, and what we want to keep and take forward. So I'm going to talk first about kind of mental health overall and what some of our current research is showing us. So general mental health, there's been a lot of talk about increases in anxiety and depression symptoms for adults overall. And that is certainly kind of the most prevalent thing we're seeing that has increased related during the past year. Also, trauma and stress related symptoms, increases in substance use, and then suicide. And we're going to talk more about suicide in a minute. I think what's important to note is that this is not happening to everyone equally. We also know that younger adults, which is really important given everything we've talked about with transition age today, are at higher risk of experiencing some of these mental health symptoms. We also know racial and ethnic minorities are at higher risk, and we'll talk more about that too, as well as essential workers, and importantly, for a family autism conference, unpaid adult caregivers are experiencing disproportionately more mental health symptoms this year. So it's important when we're thinking about mental health that a lot of these things that are affecting the general population are going to affect individuals with autism and families too, and that can be kind of a compounding stress. When you're looking more specifically at parents and children and families, This survey was done early in the pandemic. The researcher in me thinks it's really interesting, like how much the data is changing the longer the pandemic goes on and what things are going to look like after we know more about kind of the COVID years or the COVID year over time. But anyway, early in the pandemic, there was a big survey that was done, and they found that overall, most parents were reporting that their emotional well-being had not significantly decreased. So they did say that 27% of parents did have a decrease in their emotional well-being, and that they felt like about 14 of parents reported their child had a decrease in their well-being. But that's a lot less than 100%, and it's a lot less than 50%. And so I think it's really important to point out that despite these stressors, people are resilient. However, there is this group of people who really are struggling, and we know that the decrease in emotional well-being was more common for families with young children, single mothers, those who lost regular childcare, and those who experienced food insecurity. And you'll hear this theme about financial changes being a stressor for mental health throughout a couple more slides too. We also, like I talked about compounding stressors before, right? That's going to be another theme. So everyone has experienced stressors related to COVID. It's the more of those stressors, the more compounding stressors you've had, those are the things that lead to poor mental health outcomes or more mental health symptoms. And that's the same for kids. So kids who've experienced kind of like increasing numbers of COVID-related stressors are having more anxious and disruptive behaviors. When we're looking at pediatric mental health globally, I think this is important to consider too, because 91% of the student population left school and was doing virtual school or homeschooling for a significant part of 2020. For younger kids, this has led to more clinginess with their parents, which makes sense why those parents are stressed. And for older kids, we're seeing more despondency and depression, and of course, increased parental stress. Something that I feel positive about from this and that I want to take away from it into the future is there's been a lot more talk about general mental health prevention provided in a universal manner because everyone is experiencing these stressors together. And I think that's something that should have been, it has been a topic of conversation, but not as much of a conversation topic as it should have been for years, because we would rather provide universal interventions to all kids in schools, to all adults in their communities or in their workplaces, and that way we can have a larger impact because mental health should be part of the conversations about public health too. There's been some really interesting conversations about suicide. And the most recent data from the CDC looking at mortality over the last year found that nationwide suicide rates have decreased by 5%. Interestingly, it seems like ER visits related to suicidal ideation and attempts have increased. This data is messy. I think we don't know yet, and we're still learning a lot about this. It also seems like it might be something that's varied a little bit state by state, as different states have really been impacted differently by COVID. So I think we're going to continue learning more about that. We do know that kids and teens have had increased rates of suicidal ideation, which means thoughts or attempts, and that there's a couple of stressors, things to look out for the kids in your life. Things like missing important events, financial problems, in-home conflict, and changes in living situations. So again, it's those compounding stressors. COVID's a stressor we're all experiencing, but the more you have these extra things piling on, the more suicidal ideation potentially, and also just general mental health difficulties. Part of the reason I wanted to talk about the overall mental health is, one, people with autism are people. So the same stressors that impact people without autism affect people with autism too. Same with their parents. If you're thinking about families, but also we know that individuals with autism, as we've talked about all day, are at higher risk of having mental health co-occurring conditions. So if we're looking at autism, we have some early data about this. Parent survey results are finding increases in behavior problems. I'm sure the parents out there are like, well, yeah. And I think what's also interesting too is that this increase in behavior problems is worse and more steep if the individuals already had behavior problems before COVID. So it's, again, this idea of compounding stressors, right? We also know that parents of kids with autism are having more anxiety and despondency compared to parents of neurotypical kiddos. And then also we're seeing an increase in child stereotypy, aggression, sensory sensitivities, and sleep and appetite changes. The reason I bolded sleep is because there's some really, before COVID, there's a lot of really important and interesting work out there showing that when people with autism have sleep problems, which we know sleep is a big issue in autism generally, but when you have more sleep problems, you have more stereotypy, aggression. I don't know about sensory sensitivities, that's interesting, but you know that we have more of these aggression and stereotypy things too, right? So I think as a clinician, this reminds me that, okay, if sleep is being negatively impacted, like we're seeing more sleep problems during COVID, then I probably need to make sure I'm addressing that as a big issue for all the patients I'm working with. Because these other things, I don't know if it's downstream or not, but at least that might be something that's an easier fix to work on is sleep when I can't really change the pandemic, right? Surveys of autistic adults are reporting higher rates of stress, anxiety, worry, and depression than non-autistic adults. And there's one really small study that looked at teenagers reporting their own physical activity, and they found a decrease in that pre and post pandemic, which is also important to note because, again, we know that physical activity is really related to depression and anxiety and mental health. This was a survey of professionals in England who work with autistic individuals, and they were asking those professionals, just in your opinion, what seem to be the biggest stressors that are contributing right now? And there's a lot of things that were endorsed, but something that I think matches with the other research I was looking at is this idea of difficulties coping with loss and changes in routine. So changes in routine seems to be a big theme that might be increasing some of that anxiety, depression, and for kids, disruptive behaviors. Spark, which is like a big national cohort, did a survey of autistic adults and asked them what parts of your life have been most disrupted, and social life was a big part of it, as well as employment and other areas too. And then in some other surveys of autistic individuals, there were some benefits that were identified as well, and I think this is really important. Some people like virtual school and some people like virtual work. And so how do we take that, and especially for autistic people, and think about how can we apply that moving forward? Early in the pandemic, a lot of people were like, I love that I don't have to go to school as much. This is less stress for me. I feel a little worried about what that's going to look like when people do have to return to school, but also just thinking about, you know, what aspects of that, what aspects of doing school from home can we take forward to help reduce stress. Skylar is going to talk more about learning skills in a generalizable environment, so I'm going to skip that. And then another one that I think is important is that some people said, you know, I feel less pressure to appear neurotypical. I feel less of that sensory overload and social overload that caused me stress before, where I had to kind of maintain all day before I could come home and relax. I think that applies to people without autism too, because I kind of enjoy being my own like unique self. And in some ways I get to do that more when I'm at home more. So there's some positives. So maybe being more accepting of each other as we move forward into this post-COVID world. More opportunities to pursue preferred routines or hobbies. Some people felt like it was a positive to have less of that social stress, but other people felt like it was a negative. And then similarly, that same Spark study asked autistic adults, what do you feel like has been working for you? Telehealth, check-ins with therapists, journaling, sticking a schedule and making a schedule and sticking to it, exercise, and keeping in touch with people remotely. We already have a little bit of research asking what are some protective factors for kids that parents might be able to help with. The two big ones were open parent-child discussions about COVID and benefit finding. Hooray, that's the thing I care about, right? That's the theme that I want to emphasize. I also think this ability to empathize and tell kids like, yeah, it stinks that we can't do this thing we used to do before. That also seems to be a protective factor, as well as just generally having a positive outlook. The last thing that I want to mention too is COVID is not the only thing that's happened in the last year. There's been a lot of community conversations about race, racism, and violence in policing, and that has a significant impact on mental health as well. We know that mental health and COVID outcomes are really different in Black, Latinx, and other minority groups. And I suspect we might be seeing some of that in some of the differences in mental health outcomes. So while I said that suicide death as a result of suicide rates have decreased this year. They've actually increased for African American and Latinx groups. If you think about the compounding stressors idea I was talking about before, we know that COVID rates have been higher in Black and Latinx groups, as well as more death in those groups related to COVID. And then also there's been a lot of conversation about racism and violence and policing, and all of these things lead to compounding stressors that can impact mental health. The good thing about this, though, is that it's not like these disparities weren't happening before. We just weren't talking about it as much. And so I think these increased conversations is a really good thing that I want to keep with us and take forward as we move into the future. And I'm going to turn it over to Skylar.
Well, thanks, Leni. That's hard to follow. I've heard that was such great information for us all to kind of hear and process. And I'm going to assessment and treatment during COVID, and kind of the chaos and silver linings and hopefully things to take forward in that area. And this is kind of the area that my colleagues and I have been living and breathing for the past year, and the families that we worked with have been kind of living and breathing these two areas this year. So we thought it might be a really nice opportunity to kind of go back through and process kind of how this all evolved. For providers and for family members and anybody who is kind of interested in how this has changed, how it's looking, and hopefully how we continue to move forward with some of these changes, but maybe not some of the ones that weren't quite as helpful or popular. So I'm going to kind of try to jump in and talk about each of these areas. So first of all, talking about when COVID started, we just had to cancel every assessment that we had for more than, it was 4 to 6 weeks of, we have no idea what we're going to do, which I'm sure many of you experience with your work and all the things that you're doing in your lives. But when the problem with this is that we already have a really challenging kind of access to care wait list issue. And so this really may increase that wait exponentially, because people were waiting and had things scheduled. We had to cancel that for a pretty significant amount of time. Then we kind of had to figure out, how do we reimagine this entire process that we're used to doing in person, one-on-one with children and with parents and families. And how do we administer these very standardized assessments that require, very specific materials and kind of clinic space and setup, and this really direct interaction with kids and families. And then another thing we really thought a lot about at the beginning of this was just, is this even a priority for the families that we work with, right? Like, it was just such a stressful time with so many stressors, so much is autism assessment or developmental assessment even something that families are going to be interested in right now, or going to be able to kind of participate in? And so thinking about, I looked a little bit at the literature around the nation in this area, and that kind of came up quite a bit, is that idea of Maslow's pyramid. Thinking about, that before we can move on to some of these higher level things, we really, as humans, need to have our physiological needs met for, food and shelter, but also safety. And I think a lot of us didn't feel safe at the beginning of this. And whether or not, we had people that were directly exposed to COVID, or we just felt like we couldn't go anywhere safely. And so it's hard, I think, to really think about where do we fit? Where does this assessment piece fit when we're not even kind of be able to meet some of those basic needs? Dealing with job loss, school safety, their own illness, things like that. I'll move on. So we were quick to move on telehealth, which I'll talk about pretty about this, but we also, we're pretty quick to move into, okay, when we can see people again, and when it's safe for people to come back in person, is this even going to work? Because so much of our assessment has to do with evaluating facial expressions, nonverbal cues, and how do we do that when we all look like this, these pictures here? It's hard to evaluate the kiddos in their facial expressions with the masks on, but I also really was concerned about, how are our patients going to react when I look like that? Like, they're, it's going to be very unsettling possibly. And so is this a really appropriate way to try to evaluate a child? Actually the really cool thing, and Leni spoke a lot to resilience, but is the kids really, really well with this, and they don't seem to be startled at all by seeing me like that. I don't know why, because it still startles me, but they seem okay with it. So they've really done pretty well. Still having to think through, though, we want to make sure we can really see their facial expressions and reactions. We had to think through, safety, and can we, even if we have masks and goggles, is it safe with somebody for, a long 2 to 3 hours? Parent interviews are a big thing with what we do, and that's a lot of kind of one-on-one time with adults, which we know now it's a little more risky to be in the same room with adults even than children sometimes. And so thinking about how are we going to do that long parent interview? How do we provide feedback? We really pride ourselves in the families right away and in a really kind of intimate, personal, where we're having a conversation with them about these really difficult things. And again, refer to my picture up there. I feel much less comfortable having these really hard conversations with families when I look like that. And I feel like I can't necessarily make sort of the connection or eye contact that I need to really feel like the families are getting what they deserve in those conversations too. Next. Okay, so some of the silver linings is that we had to really quickly come up with some creative approaches to assessment. There was some new observation systems and assessments that were developed pretty quickly or were already in development that could be used via telehealth, and with considering the need for PPE. So we'll talk a little bit more about that. But the tele-ASD PEDS assessment that was already in development but got quickly moved forward, doing some of these sort of autism assessment activities over telehealth and having the parents or caregivers really kind of take the lead on that while the provider observes via telehealth. The BOSA was something that we quickly took on, which is basically using one of our gold assessments, the ADOS, and making it into a parent administered assessment where we're able to coach the parents through a plug in their ear, and they get to kind of be the ones administering some of these activities, because they could safely take off their masks and interact with their child, so we could see those interactions without masks. So another kind of creative way to do it. We also had some kind of national leaders in telehealth assessment. Dr. Jamison, who's going to talk in a moment, I had a while back kind of led a team through, how could we look at some of these, do some of these assessments via telehealth, because there's also the need for that when you're working with rural families, right? And families that don't want to come or aren't able to come in, drive 6 hours both ways to get this assessment. So it was kind of neat to be able to pull some of those old resources up and use those. Next. So another silver lining that we really saw was, as I mentioned before, in some of the assessments that were given, parents had to be more involved in actually administering the assessments. So we were coaching them through, here's how, do this activity, right? And so they're able to sort of have that interaction with their child, observe how their child interacts, and really be a big part of the assessment. It's also really neat for us as providers to see what are those natural interactions look like, because we know that their interactions with their parents are probably much more natural and everyday than their interactions with us in the clinic. So that's been really neat to have that a bigger part of assessment as well. So we'll hope to carry that forward, which I'll talk about in a minute. You can move on, Leni. So more silver linings. Again, we're able to, with telehealth, we got to see kids in their natural environment. One of my very first telehealth assessments during COVID, I got to watch a little person in their playroom with their brother for the entire, several hours that we were talking to the family. And I learned more about that child probably than and different things than I would have at that time interacting with them one-on-one, because I really got to see how they responded to each interaction that the brother tried to initiate. So kind of seeing them with their siblings in the place they're comfortable can be really enlightening. A lot of patients and families, felt more comfortable in their home setting. So, they they felt like this is a better way to do this as opposed to being in a clinic that doesn't feel like normal to our kid and our family. And then, of course, parents, they didn't have to drive, we didn't have to park and find their way in. So they had to take off less work, and it really was more accessible. Moving on. So we're hoping that we can continue to keep some of these in-home and natural observations, keep using observations with siblings, continue to involve parents in the diagnostic process. And, we really hope and are hopeful that we're going to continue to provide, telehealth options to improve accessibility. Maybe not for everything. We might still need people to come in, but it's definitely going to make things hopefully more accessible. And continuing to use some of these assessments for diagnoses that we have kind of started piloting using over the last year. Okay, next. So moving on to treatment, similar chaos, happened there. Had to quickly convert all of our treatment sessions to telehealth. For some families that didn't have the right technology or didn't feel comfortable with telehealth, because it was a totally different world for many. Also, just helping families understand how to structure these sessions was really difficult. Limited actions, childcare for other children was really, really hard because people didn't have childcare at this time. So other siblings are always coming in when we're trying to do pretty targeted treatment on this one child. And so, figuring out a child-friendly space that we could limit distractions and really be set up for success was a bit of a challenge at the beginning. Also, again, thinking about that Maslow's pyramid of where does, behavioral treatment fall on this pyramid, right? And our parents really and families really ready? Are they wanting to move forward with this, or are they just wanting to get by and just kind of tread water that way? Next. I think, in my experience, there's been many silver linings of doing more telehealth treatment and things that we've learned and positive outcomes. And there's the fact that we were able to continue treatment during quarantine and COVID was just a big blessing. And many of the treatments that we use really lent themselves well to telehealth. So parent-child interaction therapy and cognitive behavioral therapy, really seem to work pretty well over this medium. And many of our providers already had some experience with telehealth. So it was a pretty good transition for us, I feel like. Moving forward. So, in kind of going back to that pyramid of where does this fall, this may not have been the first priority for families, but I think a lot of families we worked with felt like continuing behavioral treatment really gave them some structure. And, if they were trying to figure out virtual school or didn't have school back in place yet, at least it was somebody they could meet with that we could kind of talk about how do we help this child transition in this really challenging time. And it was neat to be able to be there to help families make social stories about COVID or create new visual schedules for what their new routine was going to look like. This is my little guy, a picture of him, but figuring out kind of how do we make, his little office, or how do we make virtual school work for some of these kids that this is a big change for. All right. So we learned again that this could really work well in a natural setting. This is really generalizable for kids. They're practicing these strategies where they're going to use them, in their living room, in their bedroom. It was really, it increased flexibility for everybody involved. Just learn more about families, and we can actually see, oh, this is why this isn't working for you, because this is how your house is set up, right? That I didn't think about the fact that this may not work because of A, B, and C, which now we could actually see what that looks like. The insurance and companies is a huge piece that we hope carries forward, but the big change was before COVID, families had to go to a hospital or an approved clinic, a school to get telehealth services in order to be covered by insurance. And after COVID and during COVID, they covered it. You could be in your home, the provider could be in their home, and it just really opened up a whole new world of accessibility for telehealth. And just like before, parking, barriers in some ways for getting treatment. So we really hope insurance coverage stays, acceptability and comfort with telehealth stays, and we can recycle that. and hopefully it continues care and generalizability of strategies. And collaboration, it really allowed more people to join Zoom meetings, right? So that if parents were divorced or grandma, teachers could jump in easily. So in some ways, it really made some of these sessions more accessible to supports in a child's life. Moving forward. So I went and found, Dr. Swails actually found us some good research on very early stuff that's coming out during the pandemic. And this group I was doing CBT for anxiety during COVID, and they had to switch it over. So it was a manualized intervention, and they had to switch it over to telehealth during COVID. And they found some of very similar things to what we've experienced. But just some things to be thinking about, like, that you might need to modify. People had to modify their exposure activities based on, we can't go out and do things in big crowds, figuring out how to modify it. Specifically with patients with autism, certain things that became more of challenging, like possibly decreasing reciprocity during treatment because, they're focused or they don't see the person on the other side as much of as a real person. And so really focusing still on learning those nonverbal cues over Zoom is really hard. But they, again, found so many positive. They had no attrition during their study. It was so flexible. Nobody dropped out, which is really, really cool. Even during COVID, they did a lot of these activities, which we talked about, and had to figure out how to kind of practice some of these things in a more natural setting. And then one of my favorite things is rapport building, that it's really fun to see kids in their home because they show you their cat and their dog and their favorite toy. And that's really fun because you don't get that glimpse into it in the clinic. And so, again, those are hope that we can carry forward. So again, that some of these things we hope we can continue to have more flexibility as things change and improve. So I'm going to hand it over to Dr. Jamison.
Okay, thank you, Dr. Bellinger. I know something I learned during the pandemic and Zoom visits is that the 3 dots on Zoom, you can click and you can hide self-view. So I know I've disappointed a few kids along the way that they are no longer able to look at themselves. But I thought that was a good trick that I know many of us have used and I've continued to use with my own children over Zoom. Okay, so I'm going, Dr. Swails described the significant increase in mental and behavioral health symptoms, the pandemic, again, for individuals with autism who are already at an elevated risk. And so it makes it critical that we think about how we can engage individuals with autism and their families to encounter protective factors, activities, or supports that reduce the risk for mental and behavioral health problems. I'm going to focus on one important protective factor, which is connections to family, friends, and other social supports. Oh, thank you. I forgot I wasn't in control of the slide. So, families had schedules, roles and responsibilities, jobs or volunteer activities. They had expectations about jobs, expenses, plans for these things. Many people had social networks and leisure activities that provided an outlet or escape from stress or other responsibilities. And for some, time at home alone to get things done or take a break from it all. Then suddenly kids were home, living spaces, kitchens, bedrooms, and even closets became classrooms or offices. If blessed to be able to help, parents, siblings, neighbors, or other angels became teachers. iPads, computers, or telephones were the primary method for communication, complete assignments, and ask questions. And for some, in our house included, these things also contributed to meltdowns, work refusals, and eventually withdrawn expectations or commands from parents and caregivers. These disruptions to our family, work, school, and leisure activities resulted in significant change in our social and support networks, including if, when, or how we connected with people. So family and school disruptions or chaos may have included more or less time with family, depending on if your parent was gone more because they had to work, or increased shifts, or if everyone is home together. There was significant increase in the number of siblings that returned home from college to live with families. That changed the dynamic in the home for everyone who was used to living there without those people. Changes in roles and responsibilities between siblings who were, providing care or, helping with school, caregivers, parent-child interactions. Those things were disrupted. But it's important to acknowledge the social and support networks that are in place as a result of other activities, responsibilities, or day-to-day life. So, for example, Leni, can you go to the next slide? Thanks. So, for example, when you think about going to school, Leni had the number 91%. This talks about 84% of people who that setting changed for them. And there, even if, it's not just about friendships or peer interactions, it's about that network of people and support. So if you're at school, you might be sitting at lunch with someone, you are in a classroom, working in a small group. So even if those people, aren't your friends, our kids missed out on that still. That is a social support network. Teacher relationships. Some kids had spent a significant amount of time either with the same teacher or with a parent educator near them, providing them that support. That's a network that's really important, and it's an interaction with someone, and it's a secure relationship, hopefully for many. The ways that we communicated about school and between parents and teachers changed as well. But I think one of the pieces that we've seen in the studies, and then also heard from families talking about, well, it wasn't, I didn't have a lot of going on outside of school anyway, but recognizing the value of going and being around other people. The same thing for people not going to work every day. That is a social support system. In between your job, you might be talking about the things that are going on in your lives and stressing you out. And so the lack of that support is contributing to these, increases in mental health and behavioral health symptoms as well. You can change that slide. There's some silver linings, again, from some of the studies that we looked at and from the families that we work with. Dr. Swails mentioned some decreased anxiety around school. I know I worked with families who were having school refusals, and that disappeared, and work productivity increased significantly. Again, probably down the road is going to result in some other questions around, how to get someone back on track for that. But there were some families that really liked the flexibility, and if they had the ability to, really take things on at home, then they could, work in smaller chunks of time. I know another silver lining was that people were implementing behavior support plans in their home. People were using their communication systems in their home as opposed to just at school. And so the communication on how to do that between the therapist or the teacher with the caregiver increased for some families. I know not for all. Some families then really felt a significant discrepancy in their child being able to use those things that they were used to. I suppose it's a silver lining for some and others not, but everyone talked about the increased family time. But that was a positive in some of the studies that we saw, where people talked about being able to spend more time with their family and more focused time, again, doing the things that they wanted to do. I heard from a lot of the adolescent and young adult women that I work with that they made progress on art projects they were working on, completed stories that they were writing, and got to spend a lot more time doing the things that they really enjoyed. Thank you. Okay, so extracurricular activities, groups, friendships, and community networks were also disrupted. Some activities stopped, others shifted to remote, changing how those networks could provide support. I know that, again, some of the girls and young women that I worked with we offered some virtual social supports for our social group that we do, and we had comments from families that, she's getting overwhelmed with all the online stuff. So they, another family, we opted out of the virtual activities because the ones that we tried didn't go well. And so then this is, a change in how people were connecting, and experiences where you felt overloaded by the Zoom calls and the technology, then resulted in, withdrawal or fewer opportunities for those interactions in that network. A quote that we have from one of our families: some autism characteristics grew stronger with being home and less social, and then there had been more of a desire to go out and network and be around people and do the things that she enjoyed, but then those things started to decrease, didn't want to reach out to people anymore. So changes in how those networks or activities or day-to-day interactions occurred resulted in less social engagement, or changed the way that we communicated with people. We also, it's an additional effort, and so some of the kids and teens that we work with were getting a lot of their communication within their leisure activities or clubs they were in or at school, but then there's an additional effort behind connecting with people, and you have to have, whether it's over Zoom or FaceTime or online gaming and those kinds of pieces. So making an already hard to navigate complex social situation, just, compounding that, like Dr. Swails said, for a lot of the individuals with autism and their families that we work with. So some silver linings. Again, we connected with lots of people over Zoom through the summer, and we just started those things again. Something that we noticed was, and feedback that we received from the girls that we worked with and the families, that it was being able to relate with everyone in the group, because we have girls with and without autism, and it really provided a sense like everyone going through the same thing. Everyone was feeling this change in this social isolation, and we could see people kind of gain perspective around that. I put the drawing picture there because, again, time to spend doing the activities that you really want to do. You can, thank you. So we've seen resilience, of course, across the nation, but also in our autism community and families. Resilience is a protective factor, sort of being prepared. Doesn't mean that we're not going to experience stress or trauma, but that when we do, we have some tools and some preparation for being able to deal with these things and move forward better. And then resilience is associated with social support, positive family interaction. So again, going back to this social support network. I'm gonna go to the next slide. The Strengthening Families model out of the Center for the Study on Social Policy talks about using this model to build resilience during COVID, thinking of both functioning well during stress as well as parenting well during stress, and talks about the 5 protective factors within those categories of parent resilience, social connections, kind of knowledge of parenting and child development. What are the expectations we should have for kids during this time period? Concrete supports in times of need. So what did you do before that was successful? What are some strategies that you can do in terms of organization and visuals, and that it's going to provide success not just now, but make things lessen the load of what you have to handle because of these additional stressors. Of course, and then social and emotional competence of children. And that is, we know from, what develops that is confidence. It's being exposed and having some successful experiences within social opportunities. And if those are limited, then we're going to see additional challenges around being competent. You can go ahead and switch slides, Dr. Swails. Thank you. So I want to make sure that we left a couple minutes for questions. I think we're pretty close, but I hope one outcome is the continued focus on mental and behavioral health and the need for supports and networks, and that it's more about friendships or social activities, and that we need to be purposeful and proactive about making sure that these networks and social supports are built into individuals with autism's day-to-day activities, and like Dr. Swails said, the priority, like a national priority, but a priority for kind of in the work that we do in funding and supports. So I think we have a few minutes. Dr. Mosconi, if anyone has questions.
Sorry, I was just trying to find the right button, so sorry to be a little bit slow, but thank you to each of you for those presentations. That was quite helpful. You guys covered a lot. Much of it was very encouraging and inspiring. I think in particular, Skylar talking about some of the real advantages, maybe unexpected consequences that were positive in regards to living in a virtual world for a bit. But one of the questions in the Q&A, I'll get to in just a minute, but I do want to encourage people to put questions in the Q&A, and also you can request access to be seen and to be heard to ask your question in the upper right-hand corner. But one of the questions that already is in the Q&A is in regards to access related to autism and mental health services, especially in regards to adult care. And this person is wondering what each of your thoughts are in regards to expanding access for adult mental health and autism services or care within Kansas.
So actually, Matt, that was my anonymous question that I asked earlier at a different talk.
No kidding. I'm
she had
so
a
sorry.
answer about training, which everyone knows I'm super passionate about mental health training, but anyway.
You're right on. Thank you. And luckily, nobody noticed. There's always some people. So we'll move over to the session Q&A, which is more relevant. And Kiki had a few questions that she posed. The first was, with the pandemic promoting better insurance coverage for telehealth, will this be the trend going forward in your practice and in your opinion in general, since you mentioned some pros or advantages to telehealth approaches?
I think that's a really good question, and I think it's kind of unknown at this point. You know, there certainly are a lot of pros that we hope will continue, and hope that the accessibility and coverage of telehealth continues. They keep extending it, but only temporarily. So they keep saying, okay, we're going to extend this coverage for another 6 months and another 6 months. And, you know, we're really hopeful that they would just say, hey, this is working really well for families and providers, and let's just keep covering it. So we just don't know that yet. I think there'll be a lot of people that would be pretty upset if it went backwards. And I think there'd be a lot of advocacy to continue it. There are things that don't work as well via telehealth. I mean, I tried to paint a rosy picture, but the assessment piece is challenging, and certain things that, you know, certain kids really need to be seen in person to be able to kind of tease out some things and administer certain assessments. And so I'm thinking they're going to be less likely to continue to cover as much assessment via telehealth, but hoping maybe continue to cover more treatment via telehealth. But that's just my hypothesis. So we certainly can't just, I don't think it's going to work that way. There's families that need it. There's certain assessment types that are going to need to be done in person. But we did have to be creative and do things we thought we couldn't do via telehealth, and we were able to do them. So
another thing that's been challenging over telehealth is working with families when you don't speak the same language as them. Using interpretive services over telehealth has been very challenging.
That's interesting. Just to sort of piggyback on that idea, I wondered if you all have started to come across, I guess, two questions. One is, have you started to come across any sort of guidelines actually rapidly integrating data as it's being acquired to find out what kinds of clinical questions or clinical services may actually be as good and better via telehealth versus, as you're pointing out, certain questions, certain services, just you're losing something if you try to do it via Zoom or whatever telehealth procedures. Are there any field guidelines being developed that you're aware of or that you know of? I guess the other piece I was just going to say, because we do have an audience here, a significant audience, you know, what kind, do you all have thoughts about potential mechanisms for advocating and supporting, letting insurance companies know this stuff, some of this stuff is really working and needs to continue to be part of our treatment, our assessment, our clinical models?
I'm not aware of any guidelines. I'm curious if any people in the audience or if Evelyn Nelson is in the audience, if she has any thoughts on that. I will say that doctors Kathy Smith and Trevina Moore are in the process of doing a study that's looking at kind of clinician certainty about diagnosis when the child's seen via telehealth, and then whether that changes in person, and then also looking at some associated like demographic factors to see if that's related to that.
I was going to say, I hope that in years so coming up, because I think people were all kind of like us frantically figuring out how do we measure these outcomes, and how do we see how it's working, and so hopefully we'll have more information as people are able to kind of compile all that and start publishing.
There is, already a kind of a substantial amount of work out there. Again, a lot has come out of Kansas. And Dr. Nelson that spoke earlier has been kind of a pioneer in telehealth in Kansas too, because of the large rural population that we have. And I know that there are telehealth guidelines, and some of those do reflect the research around, cognitive behavioral therapy or, telepsychiatry practice. So there is a literature base. And then I bet I get alerts, every other week about an article that comes out around telehealth and autism assessment. And then, there is a substantial body of literature that around some of these things. So I think that'll just continue to grow. I think that, like you said, not like as good or better, or as, how to compare on the models when you would use it or not. And Dr. Eldebeck and I do a telehealth clinic for years where we train teams across Kansas, earlier intervention teams or school teams, to conduct part of the assessment, and then they send that information to us, and then we have a shortened visit over telehealth to increase access for our families in rural areas. And so I think, different models for different kids and different variables that go into that to determine, the effectiveness for treatment too.
I think that's a really good point. And I think, there's already been so much, the people in the field and providers that have been doing it have known that it works really well, especially for treatment, for a long time. But I think what's changed is the whole world had to find that out really fast. And so the health system had to build platforms to make it work, and patients had to say, hey, this actually isn't as bad as I thought it would be. So I think, as much as, there was people doing really great work in this before, it's like it became sort of this globally, nationally accepted thing, and kind of had to push it forward on fast forward. So, and then assessment too, everything's coming out new. But so that's another good thing. It's become much more acceptable, I think.
So Catherine asked a question about the sustainability. So related to the sustainability of some of the positive aspects of the pandemic, and the example she provides is offering study participation online when in person would be more ideal.
I guess I was going to say the short response to like the sustainability of some of them. I do think that we've already advocated or, to legislation about insurance coverages. And so I imagine that will continue, and, being part of national organizations, disability organizations, that has been very helpful. And I think will be the national and statewide efforts. And then around the study participation, or I'm just thinking too of the models that we use, because we have seen some families who, sometimes I'm like, well, we gave people a choice. First everything was telehealth, like for treatment, and then we started giving people a choice. But at some point, I think that is our responsibility as a clinician or researcher to say, well, it would be better, you need to come here versus do it over telehealth. So I do think that we have to maintain the integrity of what we're doing.
Certainly, that makes sense. So I'm not seeing any other questions from the audience now. So I'm happy to start wrapping it up. Please feel free. We do have a couple minutes left in the schedule if people do want to continue to chime in. But short of that, I wanted to thank each of you for doing this 2 years in a row, and frankly, been on the front line. So much of us owe you significant gratitude for that, but also for sharing a lot of the information that's just coming in rapidly as we kind of figure this out as we go, or have been doing that for the past year. But like I indicated, it's very encouraging to just see how far we've come as a field in sort of rapidly having to pivot and adjust online and for making it work. So thank you for being here today, and thank you for sharing all of those insights today. I want to take this next couple minutes just to thank everyone for staying on with us. We still have a significant number of people online. It's been a long day, but in a good way. I hope that each of you has felt like this has just been a day of a lot of learning and a lot of interaction, and really hopefully just setting the stage for a lot of in-person interaction next time we do this. I think we're all looking forward to this, and maybe we'll take some of the Zoom with us next year when we do this meeting. Who knows? But I'm really hoping it's not 100% hop in or Zoom. No offense to either of those groups if they have reps on the line right now, but we're all looking forward to being in person, absolutely. As a brief reminder, Sean will get on me if I don't add this, but you will be, again, receiving an email request for evaluation. The critical pieces there's going to be a text box. Tell us what we did well. Tell us what you would like to see more of moving forward. Again, these are not intended to give you extra paperwork or e-paperwork, whatever the expression is, but rather really to get more feedback and information so we can tailor these meetings to make them as helpful and productive for this community as possible. So please do attend to those. It's just about a 5-minute questionnaire, and that's about it. I think Sean also is going to drop the relevant email addresses in the main chat line so that individuals can reach out to us at KCART for any sort of supports or resources that are of interest, as well as our main Brain Lab email as well, if people want to reach out and ask questions about ongoing research studies. With that being said, we're going to wrap this up. Thank you everyone for being here, for staying with us, making this a productive and really just delightful day. Thank you also for bearing with us for those minor technical glitches on Hopin. Thank you to our speakers. And everyone, please stay safe. Have a wonderful weekend, and we'll look forward to seeing you soon. Take care, everyone.